Hello everyone, what's up? My name is Bon and welcome back to my channel. We will have a very interesting vlog for today because we will be discussing about a certain topic that is really important to reach your goal, and that is to become a nurse in the UK. We'll discuss about the tips that you should do for you to be able to ace your UK nursing interview. So if you are interested and ready, let's begin.
Hold up.
First step is to study the job description. This is really important for you to be able to have a clear understanding about the job role and the expectation of the job you are applying for. It is also important for the management to gauge the candidate if he or she possesses the qualifying characteristics for them to be able to carry out a particular role for a job. Usually, the agents or the company will send you a copy of the job description when you apply for a particular role or position. You must have a good understanding about what are the expectations for this job role and for you to be able to understand and at the same time study for that particular job role. Next tip would be research about the company. Before you apply for a job or click the apply button, you have to know what type of company or what kind of employer you are applying with. You have to have a clear understanding as well what are the services provided by your employer or by the hospital. Say for example, there are a lot of employers or various employers for nurses going to the UK. There are employers for care homes or nursing homes, hospitals, may it be private or NHS hospital. It could be an agency, it could be a bank staff, or it could be a post for a temporary role. You must also study the company profile of your employer. You have to identify what type of provider they are for the community. May it be mental health, a big hospital, a specialized hospital, a care home, a nursing home, a private hospital, or NHS. There are a lot and various employers that will offer you jobs. So therefore, before you click the apply button, you have to study what type of employer and what kind of hospital or company you are going into so that you know what to expect when you get here in the UK. It is also important for you to be able to familiarize yourself with British medical terminologies, because some of your employers might use this during your interview, or it is also a plus factor for you to be able to use this so that you can communicate and relate to your employer very well. You must have a good understanding about medical jargons that are commonly used here in the UK. Examples: handover, escalate, daytix, TWALK. There are a lot of medical jargons or terminologies that you must know. Start reading and research about those terminologies as well so that you can use them or relate to them when they are used during your interview. Next would be study basic clinical scenarios. You don't have to be an expert. You don't have to be proficient in reading ECGs, arterial blood gases, or many other nursing skills. Always remember, you are expected to be a beginner or an entry-level nurse. So therefore, just familiarize yourself on the basic nursing skills like basic life support, ANTT or aseptic non-touch technique, sterile technique, and medications and safety, because these are the main criteria for you to be able to practice safely here in the UK. Do not pressure yourself to be very proficient and very expert. Always remember, there are differences as well in terms of what we do back home. So familiarize yourself what are the common and the most basic nursing skills that can come out during your interview. They might ask you about a certain patient who fell on the floor, or a medication that was not given, what should you do, or simple medication procedures. So do not complicate yourself. Just study within your core and the basics of nursing. It might be a little bit different in terms of how they do it, but the principle is always the same. Next tip, it might help you make a template for your answer. This might help you and guide you how to construct your sentences and your statements during your interview. This will prevent you from getting mentally blocked. Utter the right words during the interview. Always remember, you have the right knowledge because of your experience and the theory that you learned from the nursing school. The main important thing here is communicate clearly so that you can convey the idea that you are trying to say. Next tip would be truthful and be confident. They would really appreciate your genuineness and being truthful and being willing to learn something new. Be brave to clarify because they don't want someone who assumes. Always remember, they would want someone who asks questions than someone who assumes and commit mistakes. Always remember to answer with structure. Be smart, be confident. Always remember to use the template STAR. Situation, task, action, and result. You may be able to relate to your employer clearly if you state the situation clearly and briefly, and you relate to the employer what task you are trying to do, relate some of the actions that you've done, and what are the results, especially the positive results, and be able to organize your thoughts very clearly rather than going round and round without getting the right answer. Always remember that interview session is like extemporaneous speaking. So we can apply some of the basic principle of extemporaneous speaking, such as start strong and end strong. It means that you have to be remarkable, you have to be relatable. The employers must remember you with your answers. Always remember there's a batch of you and a lot of you for that job position. So therefore you have to stand out. You have to be remarkable, relatable, so that they would know that you are the right person for the job. Therefore, you have to sound strong, start strong, and end strong for you to be able to be remarkable. Another tip would be know some latest research about your practice, about the nursing practice or a particular specialization, because the employers in the UK or the interviewers might ask you about what are the recent changes or what are the recent researches about a particular nursing procedure, or what research have you read lately, and discuss it to them, because they would want to gauge if you are inclined to research and provide patient with evidence-based nursing care. So therefore, it is really important for you to read and prepare for the interview by reading some researches and updates about your nursing field. And the last but not the least, always focus your answer to patient safety, because patient safety first. We always advocate patient safety in all aspects and in all nursing procedure or clinical scenarios. Read about NMC guidelines, read about nursing and safety guidelines and practices here in the UK for you to be able to relate more and give a better answer during the interview. Alright, ladies and gentlemen, we are done. Hopefully you liked the video and hopefully you learned something with our discussion. If you like the video and learned something, drop some comment down below and let me know what do you think. And maybe if you can share something for our viewers as well, for them to be able to understand and apply during their interview going here in the UK. So thank you very much everyone. If you like this video, please don't forget to subscribe if you haven't subscribed yet. Press the notification bell and the like button and share this with your friends and families. Good vibes lagi and see you in the next videos and adventure. Bye!